All right. Hello everyone. I'm Hai. I'm Hai Wu. I'm from ABflo Technology. Today it's my great pleasure to introduce our new ABflo next gen flow cytometry rapid monoclonal antibodies, and hopefully with those would accelerate your immunology research. So today, my presentation will covers the reason why we start this big effort and what we are now, and I'm going to show you a few case studies and the current feedbacks we got from our clients, and what we offer more than ABflo products. So the reason that we start this one of the biggest campaign in our company's history is that we often seen that in the market still there are a lot of new targets appearing from time to time that requires high quality flow cytometry antibodies. For example, Claudin 18.2, which is gastric cancer therapeutic target in recent years, and the GPC3, for example. And also, we often bump into different application needs that people ask, oh, can you provide a companion diagnosis grade antibody? Or can you do, CyTOF? Or can you conjugate your antibody to quantum dots? Or we want this defined epitope antibody, can you do that? I think all these are coming to really all these the new needs. Over the years, and we noticed that rapid monoclonal antibodies been outperform those traditional mouse antibody in many ways. That high specificity, superior affinity, and great diversity. So I've been doing rapid monoclonal antibodies for 10 years. We really become the advocate of rapid monoclonal antibody as a research tools. And also there's some pain point that those currently available mouse or rat monoclonal antibodies, some of them really underperformed, but we don't have alternatives, so people have to stay with them, right? There are some background binding issues, cross-reactivity issues, and some of them being low affinity. You have to use a lot of amount of antibodies to really get the detectable signal, which is also could be background binding, because a high concentration of antibody always cause problem. And with the development of those new line of rapid monoclonal antibodies, all these are recombinant antibodies. We have flexibility, and also these antibodies are renewable. Once it's done, you don't have to use anymore. So you can produce them quickly in mammalian cells. And for example, we have these, I'm going to touch that as well in the later slides, that we have this polymap can solve residue disease detection that needs multi-epitope recognition of CD38 in multiple myeloid. And also with the recombinant monoclonal antibodies, we have these very quick response to a client's needs, and also very secure. You don't have to wait for another batch produced over a long time. So all these really brings the idea that we should develop a new line, a completely new line. We call it next generation flow cytometry antibodies using ABflo brand. So, and right now we have this product line outlined in two parts. We have those core monoclonal antibodies. We use traditional full length, and also we have engineered Fab only antibodies. And also some of the antibody we would use SCFV format, or sometimes two SCFVs to really accommodate the client's needs that evolved over the time. And also we have those accessories to easy out all our clients experiments, right? You only come to us, we can have this isolate control, those fluorescent antibodies, staining kits, especially for those transcription factors. You have those intracellular staining kits. You want them to perform well and consistently, and we can offer that. And some customized labelings using your custom dyes, and also proteins, fluorescent proteins. Beyond that, in immunology studies, we typically want to stimulate the cells with certain cytokines or other molecules. We have cytokines which are highly active yet very affordable. Some other recombinant proteins in your assays. You can use our recombinant proteins to develop your assays. And of course, we also have some stable cell lines, and we offer more than that. All these accessory tool sets will come in accompany our core monoclonal antibodies to really easy out your flow cytometry antibody applications. In the near future, we might have our own a small compact flow cytometer for regular lab use. But right now, we are focused more on the cross-platform performance. So our antibody has been thoroughly tested in different flow cytometers carried by Beckman, BD, Agilent, or some other newly arised brand. All of them performed really consistently across different platforms. So currently, the product line been divided into three categories. One is covering the human proteins, those CD markers in human cells, and also we have expanding, and also this year's focus that we're going to expand more into mouse flow cytometry antibodies that really outperforms the old hamster or rat antibodies in many ways. That we really want to bring that great antibodies to your lab. Along these two major models, we also cover some of the less cared models or less used model. For example, monkey, pig, rat, cat, and dog. So right now we have a relatively limited choices, but we're expanding them as well. We're going to cover the core TBNK markers for those cells, for those organisms. And over the time, we're going to first develop those CD markers, cytokines, or transcription factors related more towards the immunology-related studies. But we're going to further expand it over the years to membrane proteins and the entire surface film, including not only the proteins, but also polysaccharides and those lipids or lipid saccharides complexes. The reason that we can bring you the high quality antibodies are all based on those best antigens we generated over the time. So right now in my team that we daily use structural biology or structural simulation to design our recombinant proteins, make sure that we have the highest quality recombinant protein produced for our flow cytometry antibody generation. So this is one of the cases that we could see the CD25 is one of the T helper cell marker that we can see we have good activity, and using that high quality antigen, we were able to generate this green line, which is really outperforms the orange line here, the control antibody from the current three major vendors. So this already we've already listed it in our catalog antibodies. You can go and check it out. But it's the cells always carry some more complex molecules like multi-transmembrane proteins, including this tetraspanine type of protein, claudin 18.2. And also there's the GPCRs, if they even have more transmembrane proteins, or We even have those ABCC 11 or TRPM for those even more transmembrane proteins. So we use stable cell lines and those cutting edge LNP and mRNA technology to solve those hard to get antigen. And with those technology, we were able to develop good antibodies, really outperforms our competitors. So for example, this 18.2, our antibody outperforms current the therapeutic antibody. And 6ER3 and CD294, we're gonna have those great antibody listed soon. So, and in addition, we have this DNA immunization. That's an old-fashioned way, and so still we have that capacity. If you're interested, certainly we can, use that as a service manual to solve your special needs. But all these technologies have been actively practiced in the team. And also we have this state-of-the-art high throughput platforms covering cell sorting and monoclonal antibody screening and characterization. So to make good flow cytometry antibodies, certainly we have one necessary step to conjugate the antibodies, the raw antibodies with different fluorophores. We use a random conjugation through chemical reactions, right? And those are typical. You activate the molecules through different chemical reactions and conjugate them together. And we also have site-specific conjugation that we can modify the polysaccharides saccharide chain here and really activates the site-specific conjugation through chemistry. So you can see it's been done. We do see advantages of this click chemistry based site-specific conjugation. The signal, the background being superior and the background being really minimal, which is great for our antibody application. And right now we have expanding. This is a few months back. We have those fluorescence. Right now we have even more expanded choices of different fluorophores. And also, if you need, we also have those HRP conjugation. And these are the fluorescent dyes we acquired from those vendors that are really, I would say, at least at the same level with the leading providers in the market. For example, this 488, which is a FISI type of fluorophore, and our fluorophore performs really consistently. If not better. So all these fluorophores are now been actively incorporated into our product lines. So I think the key is that to get those good antibodies, I think the more raw antibodies gives the greatest impact on the antibody performance. So what we did is we did thorough, comprehensive screening. Our slogan is only the best stays. So you can see, for example, we have multiple candidates, right? In this case, the mouse CD25, we only picked this the orange clone. So which is really outperforms the competitors by an order. And also only those clones can sustain different lots operation, right? So we label them at different times. Only those ones that perform consistently will stay. And for these those targets, we also did a thorough specificity check. We use K knockout or knockdown or some negative cells to really check their specificity. So, for example, here you can see LAMP2 is just a lysosomal marker that really falls back to the baseline in knockout cells, but it outperforms our competitors' antibody binding order, which is give us a really solid base to make our scientific conclusion correct. And in this campaigns, we test our antibodies not only in established cell line, but also we test them in primary cells to make sure that we not only recognize the target, but also the native target. Make sure these are the best clones, that could recognize the native proteins states. And to really deliver the antibodies to client with a reliable performances, we also did additional, let's say, formulation to really titrate the concentration that we give a solid signal, yet least background noise. So for example, you could also see the advantages of using rapid monoclonal antibody in flow cytometry, that we use only a fraction of mouse antibody. We could see like one fifth of the concentration, right? We deliver much better signal. Here is the case. It outperforms the current vendor's clone, and yet we only have 2 microgram per ml. It's really solid signal. Our antibodies take advantage of this stability that inherited from its intrinsic feature of rapid monoclonal antibody, that it really performs well across different conditions, and particularly when you accelerate their aging through high temperature, you can see it stands. So which is a great feature for rapid monoclonal antibodies. I highly recommend that you could give a rapid monoclonal antibody a try. And since the end user always have different staining conditions, different license buffer, homemade or commercial kit, we also expand the testing, right? Make sure the reliability can faithfully be delivered through to our client. So we did those commercial kits, and also we did our in-house staining solution, 2 different versions. We could see all these performs really well and consistently give you a reliable pattern of signal. But all these are the key logics behind how we develop those antibodies, how we can deliver the best antibodies to the client, right? So here I'm going to show you a few cases from the simplest single fluorescence staining, that you could see our antibody really differentiates the cell populations really well, right? You have this clear separation of different populations, even they are small. For example, this mouse NK cells, and also this special thing is about this NK1.1 is only expressed in certain mouse strains. This is coming from the, I think, C56 black, 57 black. So you can see that it stains a very small population of NK cells. And we have those CD138, which is highly expressed in plasma cells. You can see those separation of these 2 populations. And also we have a very unique product, which is also, I bet this is unique in this planet, that we have this high quality pyrimycin antibody, which is also our best seller right now, that we can use flow cytometry to characterize the pyrimycin modification treatment in protein translation studies. Often immunocells would have multiple surface markers on their cell membrane, so you would typically see some co-staining pattern. For example, this is CD19 and CD70B are staining the B cells. You can see a very clear and very well overlapping in signal, and these are the B cells. And also in this case, CD56 and CD158B was differentiated different subpopulations of NK cells, right? NK cells has significant amount of CD158B population. More color, more fluorescence always needed. So this is a simple 3 fluorescence panel. We're able to use these CD3, CD16, CD56 to really separate T cells and NK cells out. So, for example, here we were able to stain the early C56 bright cells. So those are early NK cells, and mature cells with a typical lower level CD56 expression. And we have terminal NK cells with no CD56 expression or minimal expression. You can see it. And also, but this terminal NK cells is positive for CD16. Yeah. And this is for mouse. Mouse is still a predominant model in scientific community and studying immunology and other bioactivities. And we also developed great antibodies for mouse targets. So these are the antibodies. You can see that through the CD3, we plot the cells into 2 populations, and CD3 positive population, we will be able to see T helper cells and cytotoxic CD8 positive cells. Yeah, and for those CD3 negative cells, we will see those NK cells can be faithfully stained using NK1.1 marker that we carried. So this is a little bit more complicated, complex staining using 6 different fluorescents that's done by our team. That you could see that in those lymphocytes, we were able to find singulates, and this is a CD45. It's a pan-white blood cell marker, basically stain all the leukocytes, and including lymphocytes. So you can, can be further divided into CD3 positive and negative, right? And for this CD3 positive can be further divided into CD56 positive and CD3 double positive NKT-like cells, and also traditional T cells, T helper cells, and T cytotoxic T cells. For those CD3 negative cells, using CD19 and CD56, we're able to plot them into NK cells and B cells, which all these patterning are consistent with the consensus in the community. And a little more information, new information I would bring you is that we have these ABflo high quality flow cytometry antibody based on monoclonal antibody, rapid and monoclonal antibody. But also we have a strategy that we take advantage of as the original manufacturer and developer. We have multiple clones that recognize multiple epitopes of a target, and we combine them into a formulation called a polymap. So really it gives us a new solution to address the need, for example, in minimal residue diseases. Minimal residue diseases are those small number of cancer cells, particularly those in those hematopoietic related cancers that those small remaining cells are still there hanging around, but they don't cause too much symptoms. But given certain circumstances, they may come back we call it refractory, right? Disease become refractory. So we want to monitor those. This is a great way to monitor the treatment and also monitor the risks that could be becoming more detrimental to patients' health. And CD38 is one of the key marker for minimal residual disease for multiple myeloma. There are different strategies to test. This is you can see that during treatment of antibody drug, and you would see decrease of CD8 expression, particularly in this treatment group, right? So you will see the expression level goes down. This posed challenges. Not only the population has been small, for example, here, right? CD138, we just saw that. That labels the multiple myeloma cells. But you could see that the signal here is low. So it has two challenges. But how do we address that? I think we do have a way that using our ABflo flow cytometry antibodies, that we make this polymap cocktail that could faithfully detect the even a low expression level of CD38. In the meantime, when our antibody compete with this daratumumab, we are able to to show you that our antibody and this can coexist and give solid staining pattern, right? You have this diagonal distribution pattern, which means that our antibody stains those cells that binds daratumumab, which is a great feature that your testing is not interfered by this antibody drug, right? You can faithfully detect those small population cancer or cancer cells, or sometimes some of them will be cancer stem cells, right? From the sample. So I think with those combined ABflo and polymap, we were able to solve these target occupation, pre-occupation issue. And also we have, with the high quality rapid monoclonal antibodies, we were able to address, the weak signal and the best anti-interference capability. So that would give those minimal residual disease really a great tool in diagnosis. But also, this is also applicable to those translational studies that a lot of our research lab is really aiming to do, that we have those potential markers, and we want to have better tools. We want to have more flexible combinations, right? And our antibody products give our researchers this opportunity. And of course, right now, since we don't have our own flow cytometer, we also care that whether our antibodies performs well with all these current platforms that our clients have in hands already, right? We don't want to push them to replace the flow cytometers. So you can see that our antibody performs really well, not only Beckman adjuvant, but also a new brand. And mouse cells, you can see performs well. The pattern stays, although the signal might differs a little bit in terms of intensity, but the overall pattern holds. Same thing with the human CD79B, which is a BCR component. You can see that the overall pattern holds. So that gives us a very good confidence that our antibody would address our researchers' scientific questions. As I said previously, we also developed a lot of those accessory products along with those core monoclonal antibodies we made for ABflo cell product line. So, for example, we have cytokines before treatment and after treatment. We were able to increased CD62E positive cell population significantly. And our isotype control antibodies performs not only consistently with different fluorescence labeling, but also across different cell lines. You could see these. They compare two lines, the red and this sign lines. You can see they perform really well consistently. And also we have a very special tools if we need we have a weak say weak signal, you want to increase the signal, but you don't want to cause any background binding. We have those FC specific secondary antibodies. For example, this IgM secondary antibody, right? The specificity is really good, and also it stains our surface IgM and also intracellular IgM really well. So it give you, if you have any and those type of target to be detected, you can use our IgM specific antibodies. So here are some real feedback from our client. This is for our CD4 and CD8 against the mouse, CD8 and CD4. These two works really well and really outperform the current vendors. It's become these two have become the top seller in our hands that differentiates all these cell population very well. The only problem here is that our client did not differentiate the dead cells and live cells. This actually is the real population, the live CD8 positive cells. I'll just give you a heads up. Yeah. So this is from another client that they used our CD95, which labels the cells, T cells that involves in autoimmune disease, cancer, and inflammation. So you can see our the CD95 antibody labels really well the positive CD95 positive T cells. This CD85K labels those acute myeloid leukemia patient the cells, right? And more terms of those natural killer NK cells. Right? So you can see those marker stains, the THP1 and MOM13 really well. And consistent across different cell lines, give you a really good signal. This is the signal. This is the signal you can see. Yeah. And here are some more data. I'm not go over with them each of them, but I want to point out, for example, with better antibodies, for example, CD34, even with a weak fluorescence, we were able to faithfully detect the CD34 positive cell population, but yet our competitors side-by-side control, right, did not detect the CD34 positive cells. So really, rapid monoclonal antibody represents a unique tool, particularly solving the needs in the mouse targets, because there was a much better performance. With that, in our business unit, we carry multiple product lines for antibodies. I just introduced with ABflo. Also, we carry other HC grade antibodies, and we carry proteins. We also are combining antibody and proteins into ELISA kits or ABplex multiplexing assays. So with those all consolidated resources, we were able to provide you really biologic context-based solutions. For example, in this macrophage, which is currently a hot topic over the past few years, really in the immunology field. And you can see the differentiation processes. I'm not going into details of the development, but the specialty about the macrophages that it could have slight different subpopulations through a mechanism called polarization under different stimulators. For example, stimulator using LPS, PAMP, or TNF interferon gamma will polarize the cells more towards M1 macrophages. The other cytokines like GSF or TGF beta could tilt the balance more towards to M2 macrophages. And in the next few slides that we would see how our products can help you really to match your applications. You can see that we provide all these cytokines and can help you to really differentiate the cells and polarize them into different subpopulations through those different combination cytokines. These are the catalogs that we have. And we also have more tools that can characterize and verify how those macrophage is polarized. For example, in M1 macrophage, we offer those markers. We have CD68. We also have these 86 available as well. And 6CL9 and 6CL12. These tools can really verify the identity of those cells. And those cells typically secrete a lot of additional cytokines that can be further characterized. For example, here you will see ELISA kits can help you to characterize the secretion of the cytokines after M1 polarization with great sensitivity and broad detection range. Again, with this M2 macrophage polarization, we have a different sets of antibody tools and ELISA kits. Those can help you to verify, characterize the process of M2 polarization. 168, for example, can help you to really address whether these cells are M2 or not, right? And also CD206. And we have more M2 specific CD markers coming online really soon. And for ELISA kits, again, here you will see multiple kits that can address the sensitive measurement of those secreted cytokines. So here is the last example I want to present to you that how we develop our high quality flow cytometry antibody and could also discover the potential of this antibody not only in flow cytometry application, but also in other regular applications, for example, Western blot, right? And also we have, in the immunofluorescence staining and IG staining. And of course, our core application today is flow cytometry application. You can see that our antibody really outperforms the state-of-the-art, competitors' product. So with this strong signal shift with the least background, I think our scientists could draw their scientific conclusions with more confidence. And I hope that would accelerate your research. Over the past 3 years, our team is really working hard to get you more than 300 targets covered, more than 1,000 SKU with different fluorescence labeling, and we bring this next generation rapid monoclonal antibodies for our flow cytometry clients. So that would help your research in immunology, and hopefully we wish you could expand into other fields like stem cell biology, tumor biology, etc. With that, I'll stop here, and if you have any questions, let me know.